What your toes say about your health. 8 warning signs to look out for. Often overlooked, your toes and feet play a big role in your overall health, and it's important to pay attention to their condition, says Sheena Baga, pharmacist prescriber at Lloyd's Pharmacy Online Doctor. While many problems with toes and nails are easy to treat, changes in their appearance could signal that something more serious needs professional medical attention. Here she tells Metro the main symptoms and what different health problems each sign points to, and what the solution might be. So watch this video till the end, and if you find the information useful, like and share it. Also, don't forget to subscribe to our channel. Yellow discoloration. Yellow discoloration can indicate a toenail infection, which can occur on any part of the nail, Sheena explains. This causes the nail to discolor, become crumbly, or thicken. Alternatively, yellowing could be down to nail psoriasis, but this typically comes alongside pitting or patches, and it may also be lifted from the nail bed underneath. To prevent infections, the advice is to keep your nails short and clean, wear a clean pair of socks every day, and ensure your shoes fit correctly. Dark nail stripes. A brown or black band running lengthwise along the nail, known as melanonychia, is normally nothing to worry about. When the cause is benign, it's likely either a variation in pigmentation or the result of an injury. But in some rare cases, Sheena says it's a telltale sign of a type of skin cancer called subungual melanoma. So if you're concerned, it's worth getting it checked out. Swollen toes. According to Sheena, toe swelling can be caused by a number of conditions, including lymphatic issues, poor blood flow, or even gout. Gout is a type of inflammatory arthritis characterized by sudden, severe joint pain, often in the big toe, caused by the buildup of uric acid crystals in the joints, she explains. It is more likely to occur in people who are overweight and consume. There are less serious reasons for swelling, though, including sitting or standing for long periods of time, wearing shoes that are too small, being overweight, dehydrated, or eating a diet that's heavy in salt. Maintaining a healthy, balanced diet can help with some of these common issues, along with regular exercise and movement. But it's recommended to speak to your GP if you also experience symptoms like pain, aching, or difficulty moving. White toenails. White lines or spots on the nail are called leukonychia and are often caused by trauma such as stubbing your toe. However, these can sometimes be a sign of deficiencies in protein, zinc, or iron, or of a fungal infections if the nail is also brittle and crumbly. Although rare, fully white nails are slightly more concerning and could be an indicator of a systematic illness in another part of the body, adds Sheena. These include liver cirrhosis, hyperthyroidism, or diabetes. If you're concerned and are experiencing additional side effects, contact your GP to help identify the cause. Blue discoloration. Raynaud's affects blood circulation. Picture, Getty, Metro. Always got cold feet? It could be a sign of poor circulation, which can also leave your toes with a bluish discoloration. More specifically, blue-tinged toes are a symptom of a condition called Raynaud's disease, which causes narrowing of the smaller arteries which supply blood to the extremities. A doctor will be able to provide advice if you're having circulation problems, but Sheena notes that regular exercise can also be beneficial for managing the symptoms. Itchy toes. Athlete's foot is a common fungal infection that shows as itchy white patches between your toes. It can also affect the soles or sides of your feet, sometimes causing fluid-filled blisters, Sheena adds. While it can be dealt with through over-the-counter remedies, prevention is better than cure. As such, you should make sure to completely dry your feet after washing them, especially between your toes, and wear clean socks every day, ideally cotton ones which allow the skin to breathe more easily. Ulcers on toes. We've all ended up with a blister after a day on our feet, but ulcers are different and much more worrying if you have diabetes. Unlike a blister that occurs under the skin, an ulcer is a break in the skin's surface, appearing as an open wound, says Sheena. During the time the wound is exposed, it can leave you vulnerable to developing an infection, which in serious cases can lead to amputation. Curry spoon nails. Here's where supplements may be needed. Image Getty Metro. Toenails that change shape and appear curved, concave or spoon-shaped could indicate iron deficiency or anemia. Sheena says, iron is essential for producing healthy red blood cells and maintaining proper nail health. So it's important to speak to a healthcare provider who may recommend taking a supplement. Everyone's toenails look different, but the surface of a healthy nail should be a light pink or translucent color with little variation in shade. Keep this in mind and let your doctor know if you think something might be wrong. Have you ever noticed any of these signs in your own feet or nails? Tell us in the comments. Your story could help someone else catch a problem early. And if you found this video helpful, don't forget to like, subscribe, and hit the bell icon.